It was actually easy to get here in the bypass. Wonderful.
Oh,
Yeah.
it was a smooth ride.
Very smooth ride. Yeah.
So who is Dr. Tilman Stasch?
I'm a plastic surgeon. I'm a plastic reconstructive and aesthetic surgeon, and
Yes.
also hand surgeon. And that's who I am.
That's who you are. Now, I want us, before we get to the conversation, and if you're just joining in, we are the adults in the room. Today's conversation is, why do so many people and so many Kenyans want cosmetic procedures, cosmetic surgeries? Why are we doing these jobs? Because from celebrities to our own wives, our own children, why are they doing this thing? But before we get to that conversation, when we posted your poster during the day, it elicited a lot of traction, some good, some a bit negative. So it would be unfair if I don't start this conversation by addressing something. I think you must have seen it also. So I'd like to address that so that we can get to the conversation of the day. Why did that particular poster elicit that kind of reaction?
Okay, thanks. Yes, I think there's an article online which was posted 2018.
Yes.
Which I think was an attempt to tarnish my reputation. Still, a lot of patients come to me and say, "Hey, we've read this and that," and they really just want reassurance that those are false allegations on my part. We suspect the article was published by or commissioned by 3 doctors who are in my specialty, who basically also went to court to try to stop me from working in this country.
Well, that was in 2018?
This was after a couple of years after I've come to Kenya to practice here, and I'll probably tell you a little bit more about my background.
Yes.
And so the court case was dismissed in, I think, November 2020. The judge said it completely lacked any merit. There's no evidence that I don't have certificates. I think all my certificates are beyond reproach, and also I'm highly qualified. The medical board has vetted me several times, as they do with all doctors working in Kenya.
Yes.
I still practice in Germany, as my colleagues and happy patients will happily attest. And so there are no issues that I have to hide. I'm very happy to be here, and I'm happy to provide the best services to my clients, and I believe most of them are very, very happy.
Yeah. So, as we clarify and we clear the air, it was alleged that as soon as you moved into the country, you got married to a Kenyan woman just to secure your status in the country. Is this alleged? Is this true?
No, of course, I'm married to a wonderful woman. We have 2 children. Of course, I always had work permits to get here, so there's nothing funny about that. So I've got a wonderful family, and this is my home.
Let's get back to the business of
Yes,
the day. If you're
let's
just
do.
joining in, we are the adults in the room, and we're talking to Dr. Tilman. Is that okay?
Tilman, yes.
Tilman
correct.
Stasch, a plastic surgeon in Kenya. For how many years have you been practicing plastic surgery?
Oh gosh. I think I have to probably start at telling you that I'm born and raised in Germany. I've
Yes.
studied I did my medical degree at University of Cape Town in South Africa.
Okay.
Then I went to the UK to specialize in surgery. That was about 4 years. I became a member of the Royal College of Surgeons of Edinburgh. Then I entered the specialist field of plastic surgery in the famous St. John's Hospital.
Yes.
And after 5 years in the UK, I then went to Germany, where I completed the specialist degree in, as I said, plastic, reconstructive,
Yes.
aesthetic, and hand surgery. And so I've been practicing for over 15, 18 years. I can't even count.
Okay.
Many years of hard work, long hours, and certainly a lot of very happy memories and happy patients.
Yeah.
Now that you're in our environment and Kenyan, I'll call you Kenyan because you're part of the reconstructive surgery. Why do you think that is becoming a common norm? Because these days I see a lot of personalities, a lot of celebrities, a lot of people who my colleague sometimes doesn't like them too much, and they go on their social pages and say, I've decided to get my tummy done.
Yeah.
I've decided to get this done. Why do you think we have reached that particular space or age that everyone wants to change something about themselves?
Okay, I think to clarify or demystify what is plastic surgery actually. So plastic surgery encompasses 4 pillars.
Okay.
Okay, so there's plastic and reconstructive surgery, there's
Yes.
burn surgery, there's microsurgery, there's cosmetic surgery,
Okay.
and some people also say hand surgery. So everything from the wrist down is also a field that a lot of plastic surgeons cover.
Okay.
So plastic surgery has really been in this country for many, many years. Okay, so any type of surgery that affects the soft tissues, be it wounds, be it pressure sores, be it reconstructions after trauma or cancers, all of that has always been done in many countries, including Kenya, of course, at a
Yes.
very high standard.
Yes.
When it comes to cosmetic surgery, that is probably a much younger specialty here in Kenya.
Yes.
When I came 12 years ago,
Yes.
in 2010, there were already plastic surgeons who were practicing cosmetic surgery. And however, a lot of patients still traveled overseas. So
Yeah,
you would
that
hear
particular-
that people going to India, even the US, Germany, UK, etc., etc. So, but nowadays we have the expertise here in Kenya to a high standard where cosmetic surgery is possible, and that's I think why that is the reason why people embrace it.
Oh.
And
So it was there. We just never used to talk about it, or would travel overseas for it.
I think so, yes.
Okay.
And certainly the numbers have increased. So for my own patients' narrative, it is like I would never tell my friends. But then
Yes.
once
Yeah.
they've recovered, they're
Yeah.
like, I had to tell my best friend. And
I
and
found
had
out
to bring her
about
as
6
well.
people I know. I didn't know they had cosmetic surgery with you. I found out
Wow.
today they've had cosmetic surgery with you. And I was like, no wonder. Okay, I couldn't tell them on their faces. But I was no wonder she looks so perfect.
And I think everybody has their own reasons to go under the knife. I think, to be honest, most of us don't need to have plastic surgery.
Okay.
You might be completely comfortable with your body. You might be completely happy with how you look. But then there's some people who say, okay, fine, look, I've really given my life to my family. I've had 2, 3, 4 children. My body doesn't look the same as I was 20 years old.
Yeah.
And they look in the mirror and it makes them feel sad. As I said, most people are quite okay with it, but those who feel it affects their lives, so they don't go out anymore, they feel inhibited, they don't speak up in meetings. So I hear a lot of stories. And those patients or those clients of mine, they've tried everything. They've gone to the gym, they've done the diets, they've just been miserable with their bodies. And
It's just not working out as they want.
it's something where I can offer a solution.
Okay.
Yeah. What is the most common procedure so far you've had to prioritize because, like, wow, everybody wants this in Kenya?
Okay.
Top 5.
So now we're talking about the cosmetic procedures, I
Yes,
guess.
yes.
So let me start with the men, because we
Ooh.
certainly see a lot of men coming through my clinic.
Wow.
The first issue is man boobs, also called gynecomastia.
Yes.
This is when patients are suffering from breast tissue that they can't get rid of. Even if they diet, they go to gym, and you see them, they're very muscular often.
Yes.
They maybe sometimes have a belly, but it's not actually fat. It's actually real breast tissue, and that can be quite medically explainable. And those gentlemen, they come to me, they have surgery, and they have a flat chest. For the first time, they're happy to wear a vest or go to the beach. So it changes their lives.
Okay.
The second thing for men, it's liposuction.
Okay.
Get rid of the tummy, rid of
The
the
beer belly.
love handles, yes, and just shaping it a bit, So,
Okay.
so that's for men. As for women, the top 3 I would say is mummy makeover.
Mm-hmm.
So mummy makeover is a collective term. It doesn't really. It's just meant to describe some type of surgery on the breasts, be it a breast reduction or a breast lift or breast augmentation, just some changes on the breast after breastfeeding and just putting them back into shape, plus a tummy tuck. And a tummy tuck is basically a procedure where you remove the excess skin and fat and often the stretched skin and the six-pack muscle that has separated during pregnancy. So that is removed and the six-pack muscle is put back together, and then together with 360 liposuction, meaning flanks and back, you can really get the woman back the body that they had before. And the third one, I guess, is the Kenyan butt lift. That is a term that I coined, which is basically transferring fat from part of the body to the buttocks and hips.
Okay. Now, allow me to take you just a bit behind. What are the factors one needs to consider before getting cosmetic surgery? Because we are all not the same. Some people have some difficulties, some have some allergies, or some some traits within the. So what are those factors to consider if someone is listening to us and they're thinking, maybe I need to do something about myself? What should I consider before starting or thinking of a plastic cosmetic surgery?
Sure. I think number one, you really need to be ready for it in terms of your psychological state, where you say, okay, fine, I've thought about it, I did my research, I really think I can handle the surgery itself, the repercussions in terms of recovery. There might be pain, swelling, etc., time off work. That's the first thing.
Yes.
The second thing definitely is your medical condition. If you have diabetes, if you have blood pressure problems, if you have any kind of autoimmune disorders, any medical conditions that you have that might need medication, that is very important to consider as the plastic surgeon as well, or any surgeon really.
So do you need to reveal it to you as a doctor?
Definitely.
Or that rules you out from getting the surgery?
No, it's part of the consultation.
Okay.
I think it's not it doesn't disqualify you from having plastic surgery, but certainly if your sugar is not controlled, if your blood pressure is through the roof, those things obviously need to be optimized first. Also, it's important to mention the BMI.
Yes.
BMI is body mass index, and it has to do with your height versus your weight. You can't really make a rule, but we say between 30 and 35, that is obese, and that it should be, you should try to lose a bit of weight.
Okay. Or before you get...
Because the surgery time will increase, so being under the knife or being under anesthetic will increase in time, so that increases possible risk of complications. Also, wound healing is not as good if you're so overweight. So there are other options before considering plastic surgery procedures.
Yeah.
Okay.
Is there as we talk about the considerations, is there an age gap? Is there an age gap?
Yeah, there's an age cap.
Yeah.
And there's an age bottom, I would say, as well. So although there are exceptions, generally we should wait until we're 18 before we have any surgeries done like that. There are exceptions, and those exceptions include breast reduction.
Mm-hmm.
So I've had patients who are 18 and 17 who are who have a history of years of suffering from excessive breast tissue, macromastia, gigantomastia, and you can't imagine, but these kind of patients, I removed 1.2, 1.3 kilos on each breast.
Is it hereditary?
It can be hereditary, totally, yes. And often they come with their mothers.
Okay.
And their mothers know the history. They know from themselves, having big breasts and not having had the option of having something done. So they often bring the daughters and say, look, we know what I went through. I don't want you to suffer the same. So breast reduction is a very good example of a procedure that can be done at a lower age.
Yeah.
Most of the patients that I see are between 30 and 40, maybe even older, even 50, I would say.
Mm-hmm.
The top of the age range, I think it's pretty much up to your medical status. Like if you're healthy, if you can withstand 2 hours of anesthetic, and you really want to have it done, then you can even have a tummy tuck at 70. But I have to stress, there needs to be a good reason for this, why you would want to risk it at that age. But, sometimes I get clients who've had breast implants, for instance, in their 30s, and now 20 years down the line, they want to have them removed. So I can't really tell them, no, you're too old for this.
Yes.
And in those cases, it's also, again, life-changing to get the implants out, do maybe a breast lift, add some fat, so just to reconstruct what they had. Yeah.
It's a personal choice at the end of the day.
It's a personal choice, and it's a choice that you have to make with your and also your surgeon has to be happy.
We're talking to Dr. Tilman Stasch, a plastic surgeon, and today's conversation is why do many of us are now leaning towards cosmetic surgery. And also when you talk about cosmetic surgery, it also includes constructive surgery, when you've had an accident, when you want certain changes, when you've been unwell, and it also includes part of healing. So let's not be very judgmental when it comes to that particular issue. Before we went on the break, you were talking about what we need to do or what needs to be considered before you actually go under, or what you don't need to do. You were talking about people need not take garlic or capsule tablets that are related to garlic.
Yeah, that's one of the supplements, I
Yes,
think, that,
yeah.
that can thin your blood.
Yes, or blood thinners. If you're in blood thinners, you have to
of course.
declare it.
Yes, yes.
Okay.
Yes. Mm.
What else?
Okay, so just generally, as I mentioned, your medical condition, your heart, so the medication you take, to make sure that we don't have any allergies that you could be reacting to. The special investigations that I mentioned, just to make sure that everything during the surgery is safe and that we don't have any surprises.
Now, you talked about there are people who could go under local anesthesia, and after they've finished, if it's Botox, if they come back looking and glowing like nothing happened, they slept over it and wake up. How about other procedures? Is it instant that, for example, I was doing a mommy makeover, or a gentleman was doing one of those chest things to remove the breasts? Is it that when they wake up, it will be all gone, or it's a gradual process when it comes to healing and the transformation?
I think the answer to that is you see the instant change.
Instant. So
Once
I went in,
yeah.
this, I'll come out that.
It's
That picture that we had.
Pretty much, yeah. Not an Instagram picture,
Oh, yeah.
maybe to add to that. So, but after the first dressing change, which
Yes.
usually happens after 2 or 3 days after the surgery, we kind of unwrap. I'm sure you've
Yeah.
seen the TV series Botched, where they then
Yeah.
celebrate taking off the tapes and the gums. Now, it's not as glamorous as that, because normally it's blood stained.
Or dramatic.
Patients are in pain and it's
Yeah.
uncomfortable. But yes, you see what has happened and what your new body will probably look like.
Okay.
So somebody who's had 5 liters of liposuction and the tummy tuck done, of course they can see the difference immediately. I always warn them,
You know, when
don't.
you're saying 5 liters, I'm trying to figure, that's quite a lot.
That's 5 kilos, yeah.
That's
So
a
that's,
lot.
that's, I would say that's the upper limit of what I'm comfortable with
Okay.
taking.
Out.
Because it certainly affects your body. Imagine
Yeah.
you lose 5 kilos of your
Like on
your
a
fat.
particular place.
Exactly.
Yeah.
So I always tell my patients beforehand, okay, don't look into the mirror, because you'll have bumpy skin, you'll have kind of irregularities, you'll have swelling. So the first time you should really start looking is after 6 weeks.
So after I've done maybe a mommy makeover surgery and I am wrapped and I go home, I should take at least 6 weeks before I look at the mirror or expect changes.
No,
Unless it's the 5
no,
liter thing.
No, you see it immediately. I think
Okay.
that's what I'm talking about. But the bikinis and the new clothes you don't want to buy before 6 weeks are over, when probably 80% of the healing is completed. So as anything in the body, everything takes about 6 weeks to 3 months to heal. So the final results, when we take the before and after pictures, is about 3 months. But just to answer your question, yes, you can see the difference immediately, especially if you've had a breast reduction. You can actually now sit upright. You've had a tummy tuck. You can now see your legs for the first time. However, there is a healing process involved. And that is very important that patients understand that it's not the kind of, okay, you wake up and you can have an Instagram picture and you look amazing. It is, your body has to heal, and it needs time to do that.
Yeah.
If we're honest with yourself, for example, maybe a Barbara out there would like to do cosmetic surgery and they're looking for a mommy makeover, and you're telling me after 6 weeks, within those 6 weeks, am I going to be able to go to work, or is it the 6 weeks that I'm going to be on bed rest?
No. So bed rest, not at all. So
Yes.
I don't even know one patient that I want to on bed rest, because we want to prevent any complications like blood clots in the legs.
Okay.
You know, you're wearing the stockings. You actually, I chase you out of bed immediately.
Yes.
The next morning, because we want you to be active. As you know, maybe 50 years ago, the doctor ordered bed rest.
Yes.
And yes, if you're sick
After,
with a flu, then you should stay in bed. But after surgery, we now know that the heart rate is normalized, the breathing is normalized once you get out of bed and once you start doing stuff that are normal for you. Of course, you can't go back to work immediately.
Okay.
There are some procedures where you take off 1 week, and there are other procedures where I would say you take 2 weeks. During that time when you're off, you just concentrate on the healing, eat the right things, have the dressing changes at the clinic.
So you have to come to the clinic,
have
or
to come to the clinic.
do you make it like a ward place?
Not at all. No, you have to come back. So you go home the next day after the
Okay.
surgery, but you come back to the clinic with a nurse or myself doing the dressing changes just to make sure everything's healing well.
Yeah.
And then after that, once most patients feel it, okay, now after the week, I can actually go back to work, or after the 2 weeks, I'm now ready to go back to work. Of course, they can't jump around and
Yeah.
do everything again, like go jogging. So that usually takes a few more weeks. But some of my patients come in after 2 weeks and they're like, hey, I can't believe you've had major surgery 2 weeks ago. And others still suffer a little bit. So they're still in pain, they're still uncomfortable, and for them it takes just that much longer.
Yeah.
Does someone's life go back to normal? Like, for example, you did whatever procedure, and because you said you can't jump, so fine, I understand I can't jump for the next 2 weeks or 6 months, but going forward after I heal, can I go back to the activities that I used to do or would wanted to do?
And more, I think.
Okay, nothing will tear. Out of just curiosity.
But that's why we kind of use the 6 weeks where we know that most tissues in the body are super strong again after healing. Majority of patients start after 3 weeks, 4 weeks of doing exercise again and other things. So the first 2 weeks are the most important to kind of keep it easy. And after that, it's good to go.
Okay, allow me to pick this call. Hello, Spice. Hello? 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 I will have to leave that one hanging. 0719012600. Please, when you call, remember to speak up. Don't assume I'm not listening.
Yeah, now that we are talking about the procedures and we mentioned botched, I remember so many specific episodes of botched where you find the cosmetic surgeon was correcting what had been done wrong. So,
Someone got botched.
yeah, like, what are such scenarios like? How do they look like? So that even somebody listening who's not been treated by Dr. Tilman can be like, okay, maybe, okay, this clearly I was botched,
Yeah.
Because we've had experiences where there are people who they think that they had corrective surgery and it wasn't. So what does non-corrective and what does corrective cosmetic surgery look like?
Okay, I think
Cosmetic or corrective?
Correct.
Corrective is more medical.
What does it? Okay, what can you say in plain man's English? Layman's. What is good? What is bad? And what does good and bad look like?
okay. So I think good is anything that restores form and function
Okay.
in the reconstructive surgery. Okay, in the cosmetic surgery is anything that makes the patient happy and is aesthetically pleasing, I would say. Now, of course, this is a very subjective field where you say, okay, what is botched actually? So somebody who might not be happy with the outcome, but where most doctors would say this is really good outcome, still might feel botched.
Okay.
So they use that word.
Unevenness?
Pardon?
I've seen ladies who have uneven behinds.
No,
they
exactly.
went
So
to,
I'm getting
The-
to that. So
yeah.
so I think that's the one extreme where you have somebody who will never be happy with the outcome. So we have body dysmorphic disorder. We have just expectations that have not been met, and then on the other extreme you have the real cases that didn't go well. Where maybe a doctor had operated and it did go wrong. So maybe there was an infection, maybe the technique was not correct, maybe the healing didn't take place as it should have. You mentioned the uneven bottoms, you can mention uneven breasts,
Yeah.
you can mention bad scarring, you can mention so many things where it can be many factors that can cause the outcome not to be ideal. And especially in plastic surgery, I think you have to consider that sometimes things don't go the way they should go. And then you have to trust your surgeon to explain to you and how to also fix it. Of course, you can go to another surgeon. So I see a lot of cases where patients are not happy. And then the first thing I tell them, you need to wait for 3 months for everything to settle down. Okay, so just I reassure my patients to say, okay, don't even start thinking about the outcome not being good, because your body needs to heal.
Yes.
Dr.
And then-
Tilman, I want to throw the spanner in the works,
Yes.
and I want you to be as honest as possible. Any surgery has risks.
Yeah.
Correct.
What are the risks that are involved with cosmetic procedures and or plastic surgeries that many people don't talk about between us? What are those? Because many are, if we're honest, if I'm selling a product, I'll tell you about the beauty about it. But I will not, some of us don't tell you about the risks. Are you able to share with us the risks that someone should be? Because everything has a risk, let's not lie.
True.
Yes, so sometimes I feel like we as human beings get involved in certain subjects, as you were talking, and then they don't turn out as we want, and we want to blame the doctor. So let's talk about the risks that are involved when it comes to cosmetic surgeries.
Okay. I think I mentioned expectations.
Yes.
So that's a risk. So somebody who's 100 kilos and who gives me a picture of an Instagram model, that is an expectation that I cannot fulfill. And then it would be my mistake to do the operation.
Do you tell them?
And then not get the outcome. I try to show them before and after pictures. I try to explain. And it has to be firm from the surgeon's point of view. I can't do everything. Okay. The other risks, now let's talk about the medical risks and surgical risks involved. We've talked about anesthesia. So
Yes.
there are risks associated with anesthesia. There are risks with any surgical procedure. You could have a colonoscopy and get a thrombosis in your vein, a
True.
clot in your vein, which can travel to your lung. So then there is bleeding after the surgery that can happen. Again, we take all the precautions. to
Profuse
preempt
bleeding or
that.
just normal bleeding?
Small bleedings, maybe in the breast reduction, you can have a little bit of blood accumulating in the breast. That's why we have drains. So the drains can empty the bleeding from the wound. If there's severe bleeding, then that would be a reason to take the patient back to theater to stop the bleeding. Other risks are the more long-term risks are infection. So you might have a wound that doesn't heal properly because for some reason your skin bacteria have gotten into the wound. Prevention for that is giving antibiotics beforehand, before that even happens. But if it does happen, it's important to recognize it and treat it accordingly. Wound breakdown is another complication.
What
So
is a wound breakdown?
a wound breakdown, or the medical term is dehiscence. That
Okay.
means that the body is reacting to maybe the suture,
Yeah.
or there's too much tension on the suture line, and ideally, as plastic surgeons, have that kind of technique where we know, okay, this is just the right tension to give nice scars, but sometimes you have a wound where there's too much tension and the wound opens up. So these things can happen, and as long as the surgeon is there to deal with it and the patient is reassured and treated appropriately, then in most of the cases the outcome is fine.
Okay. Then you talked about the tension and the scars. Is there a point where the scars remain or the scars phase out?
There are always scars.
They're always scars.
Yes.
So
It's a big
even if I
risk that-
look all that ripped, I will have somewhere where Dr.
always
Tilman
scars.
sliced me and sliced me and sliced me.
Yeah, don't expect us to
smoothen it
be
out.
a Photoshop
Yeah.
specialist, no?
Yeah.
So look, anything that involves invasiveness, invasive is just even liposuction is invasive, where we
Yes.
put a tiny little 3 millimeter cut into your skin, and then we use a cannula to take the fat out.
Yes.
Even that leaves a small scar.
Okay.
Sometimes it's completely invisible. Other patients develop a keloid.
Yeah.
So again, that's important to know beforehand. Are
Yeah.
you prone to keloids? Then you should probably not have surgery. But again, what is a keloid? So scars are there, yes.
Yeah.
But scars, again, can be quite obvious or can be very, very unnoticeable.
Yeah. What is the most ridiculous, just before we go into this break, what is the most ridiculous reason that somebody has ever come to you for cosmetic surgery and you were like, I'm sorry, no.
Yeah, I think no. Look, I think we get that, and
Yeah.
we get those requests. And one case was a patient who wanted massive breasts.
Like how massive?
So yeah, those massive breasts that
Really,
you don't
Karigo.
want to. that are the kind of bad examples of plastic surgery where you see in the, if you Google breast enhancement and you get these kind of 500, 600 cc of silicone implants. And there I just say, look, it's not what I do. I don't find it aesthetically pleasing. I don't think I can even do it.
Okay.
So I'm very happy to send you to a colleague, maybe in Dubai or America, where it's more common. So a lot of requests I turn down because I'm just not comfortable doing it.
If you join the conversation, we are the adults in the room, and today we're talking to Dr. Tilman Stasch, a plastic surgeon in Kenya. And the conversation is, why do many of us, many people in our country, are now leaning towards cosmetic procedures? If you have a question about any cosmetic procedure or corrective surgery, I'd like you to plug into the conversation through our social media handles, SpiceFM KE on Instagram, Facebook, and Twitter. Feel free to call in on 0719 012 and of course, you know our WhatsApp line 01102 88162. We are the adults in the room.
We have a lady from Twitter asking, "Hi doc, can someone get eyelash cosmetic surgery?"
Okay.
Eyelash.
I think the service we offer is eyelash extensions.
Oh, human
if
hair?
she means that, yeah. But for somebody, for instance, who's had a burn in their face, we can do eyelash transfers. So almost like a skin graft. So transplanting pieces of hair to reconstruct the eyelashes. It's
never
quite
come out?
complicated. Pardon?
They'll never come out?
Well, once it's taken, once it's grown there, it works pretty well. We do it a lot for the eyebrows.
Okay.
So somebody who's had facial burns, for instance, then you can transfer some hair tissue, and that works. But in terms of cosmetically, I think there's some medications out there to make your lashes grow, but cosmetic surgery, not really for eyelashes. No.
Yeah.
Okay.
So we have a gentleman from WhatsApp saying, "Hello, Spice, to the surgeon. How much does a chest lift go for?"
I wish you people on air could give us a pamphlet.
I know.
But now he has to answer that. He actually has given us the rates. Some of them are very affordable.
Very affordable.
So chest lift.
So is he asking for a lady or a gentleman? I think
it's a gentleman.
Yeah,
I think I can give you ranges. So
yes.
So there's some procedures which are fairly straightforward, which maybe take an hour. So for instance, somebody with a little bit of lipo suction for the chest or for other parts of the body, you can easily pay 450, 500,000. So it's certainly not cheap.
Or for those ones, they're not cheap.
Yeah, but the more expensive ones, the ones are 2-3 hours and more complex, it can go up to 850,000. So the prices are expensive.
Can you go open the second page? We opened the first page. That's why we were saying
I think that is
15,000.
the prices for the spas.
Oh yes,
Okay,
that's
so
why we were saying it's very affordable. It's good. This is the open page.
Yeah, this is the spa. There's
Oh,
the Vitality
yes.
Fountain Clinic.
Yes.
Yeah, I think the cost for cosmetic surgery is certainly something that can be discussed. I would say
It's an investment.
it's an investment, yes, but it's also not more expensive than any other surgical procedure.
Yeah.
So if you have a hip replacement, you can easily pay $1 million plus. If you have gastric bypass surgery, if you have a broken leg, the advantage of those medical and surgical conditions that the insurance often pays.
Oh.
And with cosmetic surgery, most of the time the insurances don't pay. So you have to be able to afford it, you have to save up for it, and then that makes it expensive.
Let's talk about gastric bypass. It seems to be a very common thing. I've had Kenyans really, especially people who suffer from weight issues, opting to do gastric bypass because maybe the gym hasn't worked or they're not able to sustain or have the discipline for it. Is it something that is recommended for everyone, or does someone need to lose a particular weight to qualify for gastric bypass? And why does it work? Why does it work for some people and others it doesn't?
Okay, so gastric bypass falls under the category of bariatric surgery,
Okay.
which has to do with surgery to reduce your weight by reducing the stomach, or by putting a gastric balloon,
Yeah.
by bypassing some of the small bowels. This is done by specialist bariatric surgeons. I'm not one of those.
Okay.
So I don't do the procedure. There are very good surgeons in Kenya who now do this, so you don't have
Okay.
to fly to India necessarily. And it is for patients, as you said, who've tried to lose weight,
Yeah.
who are not able to, who are obese or morbidly obese.
Yeah.
So we're looking at BMIs of 35 and more, 40, etc. So 100, 120 kilos. But even if you're 90 and you're 5'2", then you also have a high BMI. So those patients can undergo these type of surgeries. And the effect essentially is your intake of calories is less.
Okay.
And then over time, you still have to work on your weight. You still have to do the exercise, the less eating, etc.
Mm-hmm.
Some patients can lose 40, 50 kilos within a year or so.
Okay.
Oh, wow.
What about silicone? Is it safe for us? I know that people will say silicone is good, it'll make you look good, but over time, is it true that it seeps out, or are these just stories and myths that we see in movies and people talking from lack of information?
Okay, so silicone anywhere else than in an implant is dangerous.
Okay.
Okay, so silicone nowadays in cosmetic surgery, we just use silicone implants for the breasts and
Okay.
maybe for the buttocks. I personally don't use buttock implants. I just use fat, but for the breast, silicone implants are very well established. They are now as safe as they can be. There have been scares that it can cause cancer.
Yes.
Those scares have obviously been proven wrong. However, if you really dig into the literature, in the last 5 years, there have been cases of very rare type of lymphoma, which they think might be associated with breast implants. However, it's a very, very small percentage.
Yes.
So silicone nowadays, if it's a reputable company, it is considered safe. I mean, it's been around since the 60s, yes? And the implants have improved over the years. We're now at the 6th generation of breast implants.
Okay.
However, as with any procedure, it can have long-term complications like capsular fibrosis, where your scar tissue forms around the implant, and then can give you a distorted breast, in which case you just need to have it taken out and maybe replace it with a new one. So generally they're safe. It's been done probably hundreds of thousands of times around the world. But with any procedure, you also have to know the risks.
Would you recommend anyone who has breast implants, especially if they've had silicone, to give birth
Yeah.
or rather get pregnant?
Because the question I would ask after is it safe to breastfeed?
Yeah, that I think
Yeah.
has been proven that is totally safe.
Okay.
There's no seeping of silicone as long as the implant is intact into the tissue or into the breast milk. And a lot of patients or women who've had breast implants can have lots of babies and lots of breastfeeding sessions.
After they breastfeed, and now that we've discovered that you can still breastfeed if you have silicone, do they undergo the same problems that the rest of us fallen soldiers, for us, because now they have silicone, do their soldiers ever fall?
Well, the good thing about silicone implants is that they actually stay where they're supposed to stay. And
So you'll breastfeed and they'll stay intact?
if it's in my experience, I think the two or three kids is okay. Anything beyond that, then you can probably see changes where the breast now is so empty it starts to fall over the implant, and then you can get kind of a double bubble or the waterfall deformity. So there are certain conditions that you can then see, but totally fine to breastfeed 2 babies, 3 babies. So I can't really give you statistics, but
I get.
yeah.
I wanna
I would like to pay some bills.
Okay,
Can I come
cool.
back with you?
No
If you
worries.
join the conversation, we are the adults in the room. Yes, you've had Dr. Tilman said that myth that you've been saying, it's not safe when you're pregnant, you can't have silicone. Okay, those stories we need to stop. Let's stop demystifying. If there are any other myths or any other stories you've been hearing, I'd like you to plug into the conversation through social media handles, SpiceFM KE on Instagram, Facebook, and Twitter. Let me just pay some bills and I'll be back to respond to all your questions. If you're joining in, this is SpiceFM. The show is The Adults in the Room. 39 minutes past 9 o'clock. We're talking to Dr. Tilman Stasch, a plastic surgeon in Kenya. And the conversation today is, why do so many people want cosmetic procedures? And yes, I saw someone on our timeline saying it's becoming a very controversial thing. I don't think it's controversial. I just think it's a personal choice. People want what they want and we can't stop that. 0719012600 is the number to call. SpiceFM KE on Instagram, Facebook, and Twitter is where we are opining on the conversation.
There's a gentleman who asked me to ask you, Dr. Tilman, is cosmetic surgery possible for the male organ?
Now, that's a question I get a lot.
Trust me, she's one of those people who would ask that question. It's not a gentleman who asked. I can tell you that for
Okay,
free.
I'm asking on behalf of my friend.
You mean a reduction? Or
No.
Oh.
As you hold that thought, let me pick this
Can never
call.
be a
Then you'll
reduction.
answer these two questions. Hello.
Hey, hello, Barbara. How are you doing?
Fine, thank you, Charles. How have you been?
I'm fine, thank you. How are you guys doing?
We are well. What are your thoughts about the conversation?
First of all, I'd like to ask the doctor, with the silicone surgery, is my romance or my foreplay safe? Because I want, after the surgery, will my wife or will my girlfriend, whoever I'm spending my time with, will she feel me the way she always feels me after the surgery?
well, it depends on what kind of surgery she's having.
Yeah.
Oh, that's relating to the same question.
Yeah.
Well,
Go ahead.
let me just coming back to your the male organ. So I don't perform these kind of surgeries, but yes, there is procedures.
Sorry. I don't talk about the male organ. I mean the breast surgery after pressing the silicone.
Yes, breast implants are usually put either under the muscle or under the breast tissue. So
Yeah.
in probably 95% of the cases, the sensation of the breast is completely normal.
Exactly.
There are
That's what I
some
wanted.
few instances where the sensation changes because of the anatomy of the nerve fibers. But again, in most cases, the sensation is back to normal after 6 to 12 months.
Okay. Thank you so
Question?
much. I'm okay. I'm satisfied with the answer.
Thank you for that. 0719012600 is the number to call. Now you can answer her that question that she was asking.
The male organ.
The
Really
burning
good.
question.
Yeah, because many times, because we are a nation that loves what we love, you'll walk around the counties of Nairobi, even until, Mombasa, and you'll see posters and they are reading and saying, for enlargement, call, But when it comes to cosmetic surgery, is there a way a man can, have his male organ bigger to his satisfaction?
Yeah, I think the answer to that is again, there are procedures that can be done. I don't perform them myself. I've never had any training on it, and I also don't consider myself an expert on that field. The surgeries there are other plastic surgeons who can do. There's the penis enlargement, which is a complex procedure where some of the ligaments that attach the penis to the pubic bone are divided, and that kind of elongates the shaft. Then there are procedures to thicken the actual organ in order to just make it maybe a little bit wider. So with fat grafting, things like that. So there are procedures, but it's not my field of expertise.
Yes, let's get back to the conversation of the day. We're talking about plastic surgery. Now, for a gentleman or a lady or someone out there who are looking for a Dr. Talisman, and not you or someone else, what should they consider when they're looking for a plastic surgeon or someone for cosmetic? Because, of course, like any pediatricians, there are many. So, in your opinion, what should they look out for so that they avoid quacks? Because sometimes we find ourselves being very vulnerable because of the cost and putting ourselves at risk.
Okay, so there's certain things that you need to do as a patient in order to choose your plastic surgeon who you can trust.
Pardon me, I think I said your name wrongly, Dr. Tilman. My
it's
apologies.
fine. I love Talisman as well.
Sorry.
It's okay.
Yeah, oh yes, you know what I was talking about.
I think you're hungry.
Yeah. Yeah.
I know she is. I know she
Yes,
is.
I am. But yes, Dr. Tilman. Yes.
Okay. Right. Coming back to your question, the choice of plastic surgeon can either start with a reference, so
Okay.
somebody who's done a successful plastic surgery and who trusts that surgeon because the outcome has been perfect. That is the often a first step. Secondly, online research. Nowadays, everything is online. You can Google the surgeon. You can look at the qualifications, certainly the certificates. You can see at what training they have undergone. So I think any Kenyan surgeon or Kenyan doctor who's had experience from overseas and even locally, who knows what it takes to undergo specialist training. 4 years of general surgery, 6 years of qualifications, or sometimes 4 years is enough also. So these are the things to look out for. Are you a member of any society?
Okay.
So International Society of Aesthetic Plastic Surgeons, European Society, or are you certified in the medical board, of course, also as a specialist?
Are these things I could ask the doctor openly? Or I just have to do my
100%.
due diligence?
I think any doctor should be very happy to show the diplomas on the wall and even open the books to show all of that. And then I think asking questions. Have you done these surgeries before many times? Do you have before and after pictures?
Yes.
Maybe you can give me a name of a patient who's happy to share their experience, who've had that type of surgery. And I think the last thing is your gut feel. So do you like this doctor? Do you trust him or her? And if all of that comes together, then it could be a good match.
Okay.
Are there any insurance companies that genuinely cover cosmetic surgery, and on what circumstances?
It's a very good question, and I get that so much. Principally, no insurance company covers cosmetic surgery.
Yes.
Okay, so it's just an exclusion criteria because it's not considered medical, life-saving, etc. However, there are exceptions. So most insurances would accept things like debilitating deformities, be it extremely large breasts or extremely large hernia. So when you have a separation of your six-pack muscles and the intestines are coming out, or very gross deformities after accidents, so maybe
Like the
facial
constructive
surgery.
surgeries?
Yeah, and you
Some.
know, exactly. So if your face has been burned and there's certain points that you as a patient feel psychologically affected, those are definitely areas where we are happy to write a medical report for the insurances to pay for these things. Yeah.
Okay. If you just joined the conversation with the adults in the room, we're talking to Dr. Tilman Stasch, a plastic surgeon in Kenya. And the conversation today was like cosmetic surgery, constructive surgery, butt lifts, chest lifts from men, mommy makeovers, you just name it. I know you're wondering, is he available? Yes, as we go on this particular break, I'd like you to go to his socials. Just type Dr. Tilman Stasch. Trust me, you'll see those references that he was talking about. Plug into this conversation through our social media handles, SpiceFM KE on Instagram, Facebook, and Twitter.
Spice.
The show is The Adults in the Room, and we're talking to Dr. Tilman Stasch, a plastic surgeon in Kenya. And the conversation today was why many of us are thinking of cosmetic surgery. Now, when we talk about cosmetic surgery, Doc, I have seen some people, I don't know whether to use backsliding is the right word, but they go for the surgery, they look good, but after a couple of months or a year into it, they don't look that good. And many of us have this ideology that if Karigo and I had decided for plastic surgery, she needs to look like that forever in our heads. What happens when it comes to recovery and maintenance? Why do some people end up not looking as they have paid for? Because if I'm paying for 850K, Doc, I want to stay like that forever. I need to look as good as you left me. So
Correct,
why do
yes.
we have some people changing, or what is the science behind it? Did they backslide, or did things just go haywire in their bloodstream or their bodies?
Yeah, very good question. I think plastic surgery can be permanent, can be forever
Okay.
if you maintain it. So I think I always tell my patients, look, you need to see it as a journey. You need to see it as a lifestyle change, your life is changing. Not only can you adjust your diet and you start your exercise, you can even lose kilos before you consider having surgery. Sometimes you don't even need it afterwards.
Yes.
But then having that kind of change in your lifestyle for the first 3 months before any procedure, that really sets you up for that kind of maintenance journey where you now enjoy eating the healthy foods, you enjoy the exercise, you feel different in your body, and then you can reward yourself with the liposuction, tummy tuck, plastic surgery like that.
I like the way you saying reward yourself.
It is, isn't it? Like, and as I
You
said,
do tummy tucks?
yeah, I do a lot of
Okay.
tummy tucks.
How much is a tummy tuck?
So again, it depends. So the range is between 600 and 850,
Okay.
and depending on what is required to do. And because it is expensive surgery, there's the hospital fee, the doctor's fees, the anesthetist, the consumables, and so on.
So depending on the surface area, it
Yeah.
could differ.
Exactly.
Like another one can be
Exactly.
500, another one could be 800.
Exactly.
Depending on the
It's
surface area volume ratio.
Amesema 600 to 800.
the length of the surgery.
I was asking for a discount. What's wrong with you?
Me, I want him to use us as guinea pigs. We will volunteer.
Yeah, and just okay. So start on your journey of losing weight,
Okay.
and then you can maintain it afterwards as well. So
Yeah.
You talked about that some changes are permanent and some are not. What are those cosmetic surgeries that are permanent that I know if I pay for this, I'm going to look like this forever?
Well, look, I mean, aging catches up on everyone.
Yes.
And yes, you can kind of reboot your body with the surgery and maintain it as good as you can, but aging will still kick in at some stage, and you will start having some saggy skin here and there. You will maybe add new fat pockets because your hormonal changes are affecting your body. So that is a natural phenomenon. It's always looking at where did you start from and how would you look after 20 years versus where are you putting yourself back after surgery and then how you look after 20 years.
Yeah. Somebody asked, does cosmetic surgery affect the internal organs at any given time?
Well, this is it's an interesting question. Not per se.
Okay.
I'm just thinking of the one thing where I would say where it can improve internal organs, and internal organs can be your gut,
Yes.
the fat that you have in your gut, the mesenchyme, then the heart. By losing a lot of weight,
Yes.
you can improve your organ systems. So it's not necessarily cosmetic surgery can make you healthier, but if you look at it medically, all the changes that your body undergoes by losing weight is certainly healthy for you. Yes.
So it definitely will be a positive, never a negative.
As long as you accept the risks and complications
Yeah.
and everything goes well,
Yeah.
having plastic surgery, I think, is largely safe because we do it on healthy patients.
Yeah.
And long-term outcome, there's nothing that kind of your body switches, oh, I've had surgery now, I'm not as healthy anymore. No,
Yeah.
that
In
doesn't
the
happen.
event I'm the exception or the 2% or the 1% or the 0.01% that things do not turn out as expected because people are different, our healing processes are different. How can one tackle that if there's one person who's seated in their house and maybe they've had surgery wherever they've had and it's not looking as they wanted? What's the next step they should take going forward?
Exactly. I mean, I can even tell you that some of my patients are not happy, and it's all about accepting what we discussed beforehand and after, waiting for everything to heal, and then I'm very happy to redo something that is not perfect. So you might have a scar that has a bit of a dog ear.
Okay.
You might have
At a cost?
usually not. So if
Okay.
it's
If it's him,
if
who
it's
did
something
it.
small,
But
you
if
know,
it's someone else,
if it's someone else, unfortunately, they have to pay a full procedure. But for myself, I'm kind of a perfectionist, so I need my patients to be happy.
Yes.
Then I'm happy as well.
Are there any cosmetic procedures that are reversible?
Depends on what you mean by that.
If I have a boob job, can it be reversible?
Wow. I would say that is very tricky. No.
Okay.
That is.
So once I have it, I know this is it.
Yes, yes,
Okay.
and which makes it so important that it goes right.
And that's why you
Yeah.
were saying you need to really consider and ask yourself questions
Yes.
before you decide to get into this.
Yes.
Now, if it's someone who would like to contact you or to reach you, how can they contact you? What are your socials and what's your number?
Oh, right. So they can go on the website, vitalityfountainclinic.com. They can check my Instagram at Doc Tilman. I think
Are you on Facebook?
I'm on Facebook. I don't use it that much, to
But
be honest.
you're more on Instagram?
I'm more the Instagram kind of guy.
Okay.
I don't even post enough on Instagram. I know that. I get so many
Yeah.
requests, but I think contacting us on that or email through the website, giving us a phone call, we're always there for you.
Spice.